As a new nurse, you may be fully aware of Foley catheters, but these things, they cause more infections than you would think. So the longer it stays, the higher at risk your patient is to get a bladder infection or a UTI. Hey, my name is Nurse Key and welcome back to the New Nurse Bootcamp. Today we're going to go over infection controls, specifically Foley catheters. So Foley catheters is, here's my straw again, is a catheter inserted up into the bladder, generally for urine retention. If that person has like a stage 4 or open wound on the sacrum, it just helps to prevent further skin breakdown. It could be post-op recovery, short-term use. It could be end-of-life comfort, or it could be so we can have accurate eye and nose in a critically ill patient that are on multiple drips, multiple fluid intake, and that way we can see what we're putting in versus what is coming out. So how does Foley's actually work? Of course, we have learned the sterile technique to insert a Foley, and so with gravity, the urine will drain out from the bladder into the bag, and it's important to keep this a closed system from the tubing to the bag. You don't want to open the bag and change it out. You generally just have to change out the entire Foley per your facility's protocol. Now, any break in the system is actually an increased infection risk. If the bag is touching the floor, that's an infection risk. If the site, if you're not doing proper care or frequent care, there's an increased infection risk. So these are all considerations we need to think of as a nurse. So generally with Foley's, most facilities require you to do a CHG bath every day or once per shift. So if it's every 12 hours, you'll do a CHG bath, pericare, and I like to wipe the tubing down as well just to make sure that remains clean. If the bag, also the Foley drainage bag has to be below the bladder. The tubing cannot be like with a dependent loop. Make sure that's just like a single loop. If the bed is too low or the bag actually touches the floor, get a basin, put the bag in a basin. Don't have the bag sitting directly on the floor. If you do need a urine sample, generally we have to do Foley care. Some facilities require you to change the bag, or some people access the port, but so you have to ask your facility what's their protocol to get a urine sample with someone with the Foley. You also have a securement device. So with the tubing, you don't want it to yank on the bladder because remember we secure it with a balloon, and so you don't want it to accidentally pull out or cause trauma to that person. So you have a securement device that you place, it's like a sticker that you place on their leg or close to the insertion site, just so the tubing has enough slack that it won't pull or cause damage. And of course, just routine pericare. That's so after, urination, after a bowel movement, or just in general throughout your shift, just make sure the area stays clean and prevent any infection. So the biggest thing about Foley's is we don't use them for convenience. There are certain indications why they're giving, and we don't leave them in longer than necessary. We'll try to pull the Foley, especially if they're causing damage, if they're causing pain, or we see any urine changes. We may change the Foley or just pull it out completely. Remember, if you pull it or discontinue a Foley, you're going to make sure that person can urinate by themselves within 6 hours after. If they're not able to, you do a bladder scan and see what the residual is and see if you need to straight cat them. That's pretty much it.